skin biopsy is an invasive diagnostic procedure that makes it possible to establish an accurate diagnosis. There are three main types of skin biopsy. The first type is a punch biopsy. The doctor disinfects the skin, then administers local anesthesia, after which a special cylindrical instrument is used to collect a column of skin tissue. The instrument is rotated to the required depth, allowing a sample of the desired size to be collected. The obtained material is placed in a preservative solution and sent for histological examination, and the wound is closed with one or more sutures. The second type is a shave biopsy. After local anesthesia, the doctor uses a blade or a special instrument to cut a section of skin from the upper layers. Suturing is not required after the procedure. The third type is an excisional biopsy. It differs from the previous methods in that the doctor completely excises the pathological lesion, including a margin of unaffected tissue, and then sutures the wound. The removed specimen is subsequently sent for histological examination. The material obtained for examination undergoes several stages of laboratory processing, after which a histopathologist performs microscopic analysis. This makes it possible to accurately determine the nature of the lesion and whether it is benign or malignant.